everyone, I'm Dr. Poornima, consultant gynecologist working in Ankura Hospital for Women and Children, Bodapal branch. Today I will be talking about high-risk pregnancy. High-risk pregnancy is any pregnancy complicated by any disorder or disease which is going to have an adverse effect on the life of the mother or the fetus. So, this high-risk pregnancy, the risk factors are of mainly three types. One is the medical risk factors, second is the surgical risk factors, and third is the risk factors due to the current pregnancy. Coming to the medical risk factors, these include chronic diseases like hypertension, diabetes, thyroid disorders, both hypothyroid and hyperthyroid, connected to tissue disorders like systemic lupus erythematosus, or bleeding disorders, epilepsy, heart disease, and other diseases. In the surgical risks, the surgical risks include previous cesarean sections, previous surgeries like myomectomy, hysterectomies, or even previous other intra-abdominal surgeries like appendicectomy, cholecystectomy, or ovarian cystectomies. All these things are come under surgical risk factors. The other risk factors include previous history of a stillbirth, a difficult delivery, or previous history of delivery by forceps delivery, perineal tears, previous history of stillbirths, or bad obstetric history we call it. Bad obstetric history is a woman who is having more than or equal to 2 pregnancy losses. So, or a woman who had previous history of abnormal birth, like a baby born with the congenital abnormalities. All these are previous risk factors. And also a woman who is having, who has had a previous birth of a child with congenital heart disease. Coming to the index pregnancy, the risk factors due to the current pregnancy, these include conditions like incompetent cervix, where we put an insert large stitch, then threatened preterm labor, or patients having placenta previa, where the placenta is in the lower uterine segment, or pregnancies complicated with hypertensive disorders of the pregnancy, gestational diabetes mellitus, and also abruptio placenta. All these things are and come under the risk factors during current pregnancy. Risk factors in current pregnancy, one of the other important things are like the twin pregnancy and triplet pregnancies, IVF pregnancies, which are on the rise nowadays, because a lot of women are going through the ART procedures. The other risk factors are also the extremes of age. When the woman is very young, that is a teenage pregnancy, or older than 35-40 years, also the risk factors are increased. So this is what these are the risk factors of high risk pregnancy. Thank you.